Hi, I'm Andrew Davidson. I'm a neurosurgeon in Melbourne, Australia. I'm a member of the neurosurgery practice called Parkville Neurosurgery, and I work at the Royal Melbourne Hospital, Peter MacCallum Cancer Centre and Melbourne Private Hospital. I'd like to tell you a little bit about who I am. I originally grew up in southeast Queensland and I did my medical degree at University of Queensland, where I completed my early clinical years in the public hospitals in Brisbane. But because I come from a military background and military family, I joined the Royal Australian Navy as a 19-year-old medical student. And after finishing my medical training, I did my initial officer entry course at the Naval College in Jervis Bay before moving to Sydney, where I lived and worked for almost 25 years. During my time in the Navy, I worked at the Balmoral Naval Hospital in Sydney. I served 18 months at sea on 4 different ships, and I saw active service in East Timor with the international force Interfet and with the United Nations. After my permanent time in the military, I transitioned out of full-time military service and then back into the public hospital where I underwent neurosurgery training. Once I qualified as a neurosurgeon, I joined the Macquarie Neurosurgery Group based out of Macquarie University Hospital in Sydney. It was at Macquarie that I undertook a PhD in the molecular biology of blood vessel abnormalities in the brain called brain AVMs. At Macquarie, I completed a clinical and a research fellowship under the guidance of Professor Michael Morgan, Australia's most experienced aneurysm and AVM surgeon. During my time in Sydney and at Macquarie, I was the neuro-oncology program lead, the chair of the multidisciplinary brain tumour meetings, and I was also the head of neurosurgery at Nepean Hospital. But 2020 was a year of change for everybody in the health system. And in 2020, I spent some time working in Darwin before moving to Melbourne to take up my current position as the neurosurgery lead for the Victorian Gamma Knife Service at the Peter MacCallum Cancer Centre. I'm also a senior neurosurgeon at the Royal Melbourne Hospital and with Parkville Neurosurgery. I have a special interest in the management of complex brain tumours and vascular malformations, but I manage the whole range of adult neurosurgical conditions. I treat public and private patients. I operate at Royal Melbourne Hospital and at Melbourne Private Hospital, and I perform gamma knife treatments at the Peter MacCallum Cancer Centre. I'm currently the Deputy Clinical Director of Surgery and Anaesthetics at Royal Melbourne Hospital. I've got an active interest in medical education, and I provide high-level educational support to organisations like the College of Surgeons, the Neurosurgical Society of Australasia, and the International Stereotactic Radiosurgery Society. Outside of neurosurgery, I continue my military commitment as a commander in the Navy Reserve. In 2021, I was fortunate enough to be deployed as a neurosurgeon to the Combined Joint Task Force Role 3 Hospital in Iraq, where I received a US Army and Australian Defence Force commendations. I still work as a staff officer for the Navy Health Reserve and as a military simulation instructor. My approach has a strong belief in the principle of patient-centred care. I communicate closely with you as my patient, your family, and other clinicians involved in your medical care. Your individual healthcare preferences are extremely important in the process of shared decision-making, and I encourage you to be actively involved in your healthcare decisions. Your voice is extremely important, and you have the final say in planning your medical care and treatment. Thank you for watching my video today. Please visit my website, www.asdavidson.com.au, for more information about the neurosurgical conditions that I treat and my consulting locations. Thank you.